Then sources of data, we have primary data. This one we can get directly from the client. Then we have secondary sources, which are the family, supportive persons, reports, and the health professionals. Then we have tertiary sources. These include external sources like textbooks, journals, and the surveys. So these are more so when we read from the internet, they contribute much to our knowledge. Then we still continue with methods of data collection. So we have health interview. So in the interview, um, the health interview is a purposeful communication, and it involves taking the nursing health history, creating rapport is actually the major foundation of the assessment phase. So you make an appointment with the patient that I'm coming to interview you. So she will also be ready, and as you interact with the patient, you can be able to get information from her. So right there in that picture, you can see that a nurse is having her pen and a file ready to note down anything that the patient tells her. We continue with the collection of data. So besides interviews, nurses conduct physical examinations. We examine the patient from head to toe, and that is our responsibility. Though the doctors do so, but also us, we also do examine. And there are some things that we shall be able to find out. Then referring to health history and family history. So you can refer to the health history of the person and the family history. This can show you a lot about the patient. Then observing the patient aids in gathering assessment data. So you observe around and see. The eyes of a nurse should always be sharp. There are other things that you will identify from the environment. There was a patient who was admitted with the diabetes. So the junior doctors did not identify exactly what is wrong with this patient. But this patient was having water by his side, and all the time taking water. So when the senior doctor came, when they were in interacting with the patient, the senior nurse asked the doctor but doctor, have you people thought of checking for diabetes? Because what we have seen is this patient is always taking a lot of water, and the jar of water is always by his side, taking a lot of water, and also our urine output is much. So that opened people's eyes. And indeed, when they did the glucose test, it showed that the person was having diabetes. So as nurses, there are things that we can observe also. Then we can help the doctors make decisions. Then establishing accurate assessment leads to better diagnosis, planning, and interventions. Utilizing observation in assessment. So patient observation is reliant on the 5 senses. Provides information about appearance, function, relationships, and environment. So the senses that we use in the observation of a patient include the sight, touch, hearing, smell, and the taste. So we use all these senses. When we are around, we make sure that we observe in every corner of the patient. We observe the patient himself. Then also we can also touch the patient during examination to feel for the temperature and other things. Then hearing, we hear the way the patient is talking, the way the patient is breathing, and many other things. Then smell, this is the most important. Smell around the environment. This will tell you a lot. Yeah. So with the testing, this normally is not so much encouraged because there are many things that come testing may end up bringing infections, but where necessary it can be used. So, for instance, like if you can use this to find out about actually the patient's test, you yourself, you may test a certain food and fail the test, but if you give the patient to eat that very food, then the patient will not be able to tell the test. Then that means there is something wrong with the patient in that specific area. Then vital in making accurate assessments. So all these ones are very, very important to make sure that we make vital assessments. When we put all of them together, validating data, validation process verifies this. And this involves double checking before you come to conclusion that this that you have done is the right thing. You need to double check it. For instance, taking blood pressure and it is high, it means that the person may be having high blood pressure, but you are not sure. This is not conclusive. So what you will do is you can take it again. Then you see if you take it like 3 times after the patient has rested, then again after the patient rests again and it is still shows the same, then you have the right to involve the doctor in that. Then yes. So a comprehensive assessment, this is like a detailed assessment. So validation of the data in such cases is very, very important. It requires avoiding conclusions without substantial data support. So key aspects of ensuring data accuracy. One is double checking. This I've already talked about it. Validating subjective and the objective data. Then avoiding premature conclusions. You don't jump into conclusion before you verify. Then clarifying ambiguous statements, statements that give you double meaning. It can mean A, it can mean B. So you need to first single meaning and it should be clear. Gathering overlooked details. There are some details that some people don't pay attention to. So you need to go into details of all that in there. Then distinguishing cues from inferences. So cues, these ones are like statements that are not confirmed to be true. Then inferences, this already you have evidence that shows that what is being done is true or what is being said is true. So you can refer to that. Documenting accurate data. Accurate recording is fundamental. So when recording data, make sure you record the right information that has been given to you. Then involves correct data collection and documentation. Should be accessible to the entire healthcare team. Is crucial for evaluation and also references. So in the future, like anyone can be able to reference to it. Then